Are you thinking about joining nursing school at whatever level, be it certificate, be it diploma, be it degree, and you have little to no knowledge of what nursing school is all about? Then here's the video for you to shed some light of what the nursing course entails. Hello, hi there, welcome back to my YouTube channel. If you're new here, thank you for joining us. This is Caffeinated Nurse. My name is Faiza. I hope you're having a great day. Hope you're having a great week, great night. Whatever time you're watching this video, I hope you're having a nice time. I'm going to be generally speaking about this. If I have to be specific, I'll mention it. Depending on the level that you are enrolled in, that is the certificate, diploma or degree, half of the time you'll be spending it studying the academic aspect of nursing. Other half of it will be doing your clinical placement, which I will get to in a bit. The academic aspect includes theory about the human body, both normal and abnormal. Example, you'll be studying anatomy, physiology of the normal human body, and then there's the pathophysiology, that's the abnormal part of the human body. It also involves you attending classes or lectures, attempting RATs, attempting CATs, exams, the end of semester exam, whichever it is. On top of the classes, CATs, exams, whatever, there's also the skills lab aspect. This is usually a designated place for the nursing students to learn their skills, their nursing skills. They learn how to perform basic nursing procedures. You are taught how to take vitals, how to administer medication, how to bed make, how to communicate with your patients, to give bed baths to your patients, and many other skills. I can't be able to mention them all in this video. And that, generally speaking, is the academic aspect of nursing school. And then we have the clinical placements. This involves the nursing students being exposed to the real world, real hospital setup, working with real patients, not manicans anymore. Depending on the schools that you're going to enroll in, different schools have different procedures that they go about the clinical placement. You might find yourself that you're not doing all your placements in one hospital. One time, one semester, or one clinical placement, you might be in Nakuru. The other clinical placement, you might be in another county. Other schools, they have one place that they can do all their clinical placement. And also, the length of this clinical placement is different. For example, for the diploma nurses, it's not the same as for the degree nurses. But all in all, there is a designated hours or weeks for a specific clinical placement. I did bachelor's degree nursing, so for me, the longest clinical placement was, I think, 8 weeks, and the shortest was 2 weeks. Now, during this clinical placement, there's usually a clinical assessment, and it's usually done when the clinical placement is about to come to an end, maybe the last 1 week or the last 4 or 3 days. Basically, it's an exam to assess your skills. Throughout your 4 weeks of the clinical placement, you've learned common procedures in that ward or whatever department you're in. During the clinical assessment, the clinical instructor will require you to showcase your skills. For example, if you're in a surgical ward, the clinical instructor will expect you or need you to showcase how you go about your wound cleaning procedure or wound dressing procedure. It has to be the ideal way, using all sorts of equipment that are needed. You're not supposed to use any shortcuts that you've learned throughout that clinical placement. Based on how you go about the procedure, you earn marks. Different schools have different pass marks. For my school, most institutions that offer the bachelor's degree, the pass mark for the clinical assessment is usually 70%. I understand for the KMTC students, the diploma nurses, it's usually 50%, but correct me if I'm wrong. Something else that most people don't know in the bachelor's degree, there's a curriculum and instruction unit. It entails how you can formulate a curriculum, how you go about preparing for classes, how to teach, how to create lesson plans, basically just to become a nurse tutor. What happens with its clinical practices that you're taken to a school? Most of the time, it's usually the KMTC's institutions. You're assigned a class. You formulate a lesson plan, you prepare for that class, you make notes, you teach that class, and you're also required to make an exam or a CAT based on whatever lesson or unit that you are teaching, and then mark those exams, mark those CATs, and award marks. This only applies when you enroll for a bachelor's degree in nursing. When you enroll in nursing school, especially for the bachelor's degree, you're going to be having common units in the first to second year of nursing school. Common units means that everyone in that school does this unit, be it that you're in law school, music school, business school, or even nursing school. You have to do these units. They are usually different depending on the institution. Where I studied, that's Kabarak University, our common unit was Bible, because it's a Christian-based school. Institutions like Leicester University, they have English as a common unit. Now that you have a little idea of what nursing course entails, there are some tips that could help you have a smoother ride through nursing school. Number one, don't lose your notes. You might think that these units that you're learning in the first year or the second year are not relevant anymore in your third year or fourth year. Trust me, they're relevant, especially like the anatomy and physiology. They are always relevant no matter which unit you're going to be studying in your third year or even your fourth year, second year even. So don't lose your notes, because you never know when you're going to be needing to refer back to them, so that you don't have to keep on going to look for textbooks. It's sometimes hectic. And imagine you're in your third year and then you need a reference for anatomy and physiology. You don't have your notes. And at the same time, there are first year students who are studying anatomy and physiology. So even if you say that you're going to be looking for a textbook in your library, chances are you're not going to get one, because the books will be borrowed by other people, and then you start stressing or use books that are not even relevant, that will waste your time. So you better have your notes, just in case. Make sure that you have access to the course outline of each unit that you're going to be studying for that year or that semester. My classmates will always wonder why I would strive to have these course outlines. They literally helped me know where to study or what to study for each unit. It was like a study guide. That thing is that you need to identify your main coursework book for each unit. And if the lecturer hasn't said anything about the main coursework book, it's always in the course outline. If it's not in the course outline, you're free to ask what's the main course book that you should use for a certain unit to your lecturer, and I'm pretty sure they can guide you to the best. If this book is not available to your library, there's always sites that you can download free books. These medical books are usually really expensive. You don't have to buy them while you can download them for free. In addition to you having a main course book, you also need supplementary books. These are books that you can use to boost information that is in the main course book. Example, like for midwifery, there's the Margaret Miles textbook of midwifery. Med-surg, medical surgical nursing, you have the Brunner Institute's medical surgical nursing textbook. The last tip is that during your clinical placement, please, I beg of you, avoid using shortcuts. If you feel the need to use shortcut, please familiarize yourself first with the ideal ways to do certain procedures. They will cost you during your clinical assessment, and they will probably cost you during your future career and practice. That's it for today's video. I hope you learned something. I hope that you now have a slight idea or pretty much good information about what nursing school or the nursing course entails. As always, if you have any questions, feel free to ask them in my comments, or you can follow me on Instagram. If you're not feeling comfortable typing your business in the comment section, you can always DM me. I'll leave the link to my page in the description box, so you can go ahead and check it out. See you in the next one. Bye. Under a tall palm tree.